Hi, I'm Dr. Bart Klika, the Chief Research and Strategy Officer here at Prevent Child Abuse America. I'm here today to do what I'm calling a research review. These are something that I'm going to be doing each month on different topics as it relates to the field of child maltreatment prevention. Now, just to be clear, these research reviews are not meant to be conference length presentations, but more just a snapshot of some new and emerging research that exists in the field. I have embedded down in the notes the links to these articles. When possible, I will try to provide you with the actual articles. Due to copyright laws, there's times where I'm only going to be able to provide the link to the article. So let's get started for this review. There was a recent article by Levy and colleagues that was a review of randomized controlled trials looking at interventions to reduce the risk factors for child maltreatment. One of their conclusions was, from the studies that they reviewed, we know very little about those who participate in home visiting programs but have a history of child maltreatment. So today I'm reviewing a couple studies coming from the work of Bob Ammerman and his colleagues that look at women who participate in home visiting programs and some of the factors that may contribute to success or not having success in home visiting programs. So the first one is by Shank and colleagues, and what they looked at is for women who were participating in home visiting programs, so they're already participating in these programs, they looked at the association between a history of child maltreatment and then their levels of parenting stress 18 months after enrollment in home visiting services. And what they found is that there is a link between these two, right? So women who had a history of child maltreatment, they have increased parenting stress over time. One of the things we try to do in research is what's called figuring out the mechanisms between relationships. So what we're trying to do is figure out, well, why is it that child maltreatment would potentially increase parenting stress? So what they looked at are some of the factors that may be related to both child maltreatment and parenting stress. And what they came up with are two factors that they looked at. The first one was maternal depression, and the second one was social support. So what they found is that for women who had a history of child maltreatment, they had decreased social support at enrollment. Decreased social support at enrollment predicted, right, so it increased the likelihood of increased depression symptoms at 9 months post-enrollment. Maternal depression at 9 months post-enrollment then predicted increased parenting stress. So we say that these factors partially explained the relationship between child maltreatment and parenting stress. The other finding that they had was that for women with a history of maltreatment, they had increased rates of maternal depression at entry or enrollment in the home visiting program, and that depression at enrollment predicted depression at 9 months, which we might expect, and that depression at 9 months then predicted increased parenting stress. So what they were able to identify is not only the association between maltreatment and parenting stress, but some of the reasons why that relationship might exist. The second study we're looking at is the Folger study, and what they looked at, again, looking at women who were in home visiting programs, the association between interpersonal trauma and then the child's social and emotional development at 12 months post-enrollment. And very similar to our previous study, what they found is that those with a history of interpersonal trauma had increased depression symptoms, less social support, which then predicted decreased social and emotional development of their children. So what are some of the implications of some of the findings from these studies? First of all, I think it highlights that a number of the women who participate in home visiting programs have experiences of trauma or maltreatment in their history. And we know that this subgroup of women participating in home visiting programs may be at risk for negative outcomes or may not benefit in the same way from home visiting services. We need to think about how it is that we screen for maltreatment history, but also how it is that we start identifying factors such as maternal depression or levels of social support so we can think about modifications that might have to be done to our programs to support these women. That's what I have for today. If you have ideas for future research reviews, please send me an email at bklika@preventchildabuse.org. Thank you.